solidarity to all of you from Unifor. We proudly represent 315,000 workers all across this country, including some pretty kick-ass healthcare workers. Some of them are here today, but I have to tell you before I get into talking about why we need Pharmacare. Yesterday, these healthcare workers in this province had a very big victory, and we should recognize it. When the highest court of this province held up their constitutional rights and slayed Bill 124. Congratulations to everybody. So, a massive shout out of love and solidarity to healthcare workers all across this country who are holding up the public healthcare system for all of us right now, despite some pretty big challenges: underfunding, understaffing, privatization schemes, and of course, burnout. And we're all here today talking to senators, talking to members of government to demand and to defend public health care for all by placing strings on federal transfers. This is what we want. By enforcing the Canada Health Act. This is what we want. And if provinces do not protect public health care, Ottawa must do so in their stead. Now, this week has been about more than conversations. It's also been about a lot of action. Because together, we're not just hoping to save public health care in this country. We're building the arguments and the foundation for it. And I know how relentless these activists are when it comes to standing up for public health care.
Brothers and sisters, siblings, it's true, when we fight, we win. There's a fight in front of us, and I want us to remember who we're fighting for. I remember actually, when we were still in this building behind me, I met a young boy, and he was with his parents, type 1 diabetes. And he told me he's got to do all sorts of things. Anyone who's got diabetes knows he's got to monitor his blood sugar. He's got to take medication. Sometimes he's got to do injections. And if he doesn't do it, he knows if he misses it, the worst consequence he could die. But he told me the thing that he's most worried about wasn't his illness, wasn't the medication, weren't all the injections. He was worried about how much the medication was costing his parents. This was an 8-year-old boy, and he was worried about costing his parents too much just to stay alive. So that's why we got to fight. We have a fight in front of us right now. I looked at Prime Minister right in the eyes and I said, we need by this March 1st, this deadline, we need the legislation to lay out the framework for universal pharmacare in our country by the March 1st deadline. I made it clear to them. And I want to make sure one thing's really clear. Who do you think benefits and who do you think suffers if we don't move ahead with Pharmacare? There's a very clear line here. If we have universal Pharmacare, that's good for workers, that's good for families, that's good for seniors. If we don't have Pharmacare, who is the only two groups that benefit from not having Pharmacare? Well, corporations is the best answer, actually, because that kind of summarizes it. Good job. Big pharma and big insurance companies. They're the only ones opposed to this.
Pharmacare is not a blue issue or a red issue, an orange issue or a green issue or a block issue. It's a human issue. And the Health Coalition participants in this lobby here today are healthcare frontline workers, and we know people out there are suffering absolutely every single day. They can't pay for their medications. And they have to make tough decisions. Do I buy food? Do I buy my medications? Do I buy my prescription medication? Or do I buy the ones for my children? So those decisions should not have to be made in a wealthy country as Canada. We have the solutions. It's National Public Drug Plan, Pharmacare for all. Do it now. Ignore us at your peril, because this will be a ballot box issue the next time that we're in an election. So Pharmacare for all, do it now, because profit doesn't care. Profit doesn't care, we care.